I'm going to start with my number one thing that I do to make sure that self-care is very important while working, and that for me is working out. For the past 2.5 years, y'all, I'm telling you, I've been getting my Billy Blanks on. Richard Simmons.
Royce, it's sweating time!
And sizzle. Let's keep it moving because you're going to get me started. Anyway, tip number 4.
This happens everywhere.
Let me check my 4th note, which is communicate about expectations, concerns to staff and colleagues, right? So what I meant by that is be very clear to nursing staff, be very clear to your colleagues, be very clear to consulting physicians what you can't do or what the concerns are, and that's it. And I think sometimes when you are very opaque about things, it leads to more calls, more questions.
Yep.
Just more, it's just not it's not a good situation because people don't know where you stand, right? So for me, when I start my evenings or whenever I start my mornings, when I'm rounding in the ICU, the first question I always ask, I'll say, what happened overnight, right? Then the second question I have is, what are your specific nursing concerns that you have? Specifically that you have. Because I don't want to hear from you 2 hours later about something that you should have brought up an hour ago, 2 hours ago, and I'm in the OR now. So I just say, what concerns do you have? And then by the time I'm walking out of the patient's room, I ask the nurse, I'm like, okay, so we covered A, B, C, D, E, F, and G. Does that address, the issues that you may have? Good. All right. Don't call me. I'm out.
Don't call me. Love you, but don't call me.
I'm out. Don't, you know what I'm saying?
Yes.
Or, with colleagues or with coworkers, I'm very clear, hey, listen, I just want to make sure you're consulting me for A, B, C, and D, right? Okay, cool. I'm going to write down specifically about this, and this. And just to be clear, you will be following up on this, right? Because I'm going to document this, right? That's how I talk with them and stuff. Right. Because for me, it's just I always have this thing, and this is why I'm in therapy probably. I always have this thing of if I'm not clear, then there's all this stuff that's swirling in my mind. The T's are not crossed, the I's are not dotted. Do you see what I'm saying? And I can't move on. So that's why I'm just listen, I know it's uncomfortable, but listen, when I finish seeing this trauma patient, you, the ED doc, you going to discharge, right? All right. Cool.
Dr. Darko, this patient is still in the ED. He's just wondering when he...
I cleared the C-spine, and all their trauma labs or all their trauma stuff is negative. I talked to you already about it. Don't call me 2 hours later saying, hey, are we discharged? I told you.
Yeah. So clear communication is definitely self-care.
Yes.
That you are right about. So I learned about that.
You sure you can cover me for this date? You sure?
So I learned about that specifically with...
You triple sure.
Especially in clinical decision making.
Because my wife, the habitual line stepper, if I don't show up on this thing...
What's she going to do?
She going to line step.
Okay. So anyway, I learned about specifically being very clear and creating conditionals, which I'll tell you in a second.
Was that off-ramps?
No, not necessarily off-ramps, but creating conditionals in clinical, in your clinical decision-making in medicine so that you get the calls that are pertinent. And I learned that from Dr. Vadia, who was my gyne-onc attending.
You be naming all these people. They don't want to
she
be
was
named.
Good. She was good. She was a younger attending. So she definitely, she knew what her boundaries were.
Okay.
She had young children. She liked to be home with her kids by a certain time, and she was very clear. And so you knew exactly what Dr. Vadia wanted you to call her for and didn't want you to call her for. She was extremely clear. She was like, if this, then that. If that, then this. If this, do not do that. If not this, then do this.
Sounds like trauma.
I mean, yeah, she was very algorithmic in terms of her communication with us to say what she wants to be called for and what she doesn't want to be called for. And I learned that very early enough so that when I became an attending, I could replicate that and let the nurses know, call me if this happens, call me if this doesn't happen, and I think that makes for self-care because then you don't have people calling you because they don't know what you want them to call you for. So, yeah, she put out 200 of urine in the last hour. Great. Why are you calling me?
Yeah, I think one of the things that drives me nuts.
Why did I get that call?
One of the facilities that I'm at is like, I'll get like a page at 2 a.m. of like, yeah, someone's like home medications are like reconciled. And it's just like, okay.
It's just blinking.
Like, you know, it says NPO for like a case, right? You know, the nurse is going to be mad at us, but y'all be doing that shit. We call ourselves out, but sometimes we got to call you out too. So stop fronting.
Well, I think, you know, again, but that part of that is clear communication.
Don't call me for no home med reconciliation at 2 a.m.
Some of that is clear communication.
Oh,
right?
Man. But clear communication gets rid of the ambiguity. You can just move on, right?
Yes.
Ask questions. It takes the emotion out of things when you ask questions, to me, in my opinion, right?
Yep.
And then give options if there are. So that's what Dr. Vadia was doing.
Yep, if this, then that.
I think one thing that the residents can definitely talk about or can definitely experience, and I think internal medicine doctors experience this a lot. Hospitalists experience this a lot, is getting dumped on, right?
Ugh.
Because
I could not be. I am.
Yeah, because hospitalists.
I feel bad.
I
for
even
y'all.
go front, yo. Like they are.
I feel bad for y'all.
Oof, they get dumped on a lot.
Y'all are the city dump.
And I think one way I saw this on Reddit, and it made a lot of sense. Like, you got to be really careful because it's very easy to start snapping at people.
Oh,
right?
yeah, of
it's
course.
very easy to start snapping at people.
Of course.
But a lot of times when they call, like either way, like if they call, like you can't just hang up, right?
You could,
but you got to handle it. So I think one way to look at it is this: like, look, like, you know, I think sometimes there is this like me versus the world type of mentality, right? Which is the opposite of the beratement type thing, right?
Mm-hmm,
Which is you got beratement on one side, which is like, yo, man, I can't believe I messed this up. I ain't shit, you know, you know, stuff like that, right? Mm-hmm. Like in my head, not physically,
right.
I'm in therapy, right? But then there's the other side, which is like, yo, like we ain't admitting nobody on this service. Don't call me, yo. It's me against the wheel. We just trying to get through. And that's just as stressful, right? Because anytime someone calls you, it's like, yo, why are you calling me about a potassium of 2.7? Because it's low.
No.
So why are you calling me about that? And it's like, but dude, like you
call ortho.
You getting up. Yo, let me see if I can like tap the bone and release some potassium and calcium or something like that. Anyway, but like, ortho, we love you. But I think that having that other approach can be just as stressful also, right?
Oh, yeah, absolutely.
And I think if you just look at it as, look, man, this is the game. This is the game of being in the hospital. This is how it is. We're in a litigious, you know, United States. Everybody wants to cover themselves. Or some people may not just be as educated, quote unquote, as how you think you may be. So like having like this, being upset about certain things in the whole scheme of things is really not that big of a deal.
Yeah.
Like, is really screaming at that nurse or screaming at that caseworker or screaming at your colleague really going to get you through the day any faster than
no.
Which
and
really
if anything, if you are so very miffed.
And just so y'all know, nurses be screaming at each other too, y'all. So
of course they do.
Yo, y'all be nurse on nurse crime.
Yeah.
Ay.
But if you are so very miffed about, you know, an interaction that you had, you know, based on some clinical decision that either was or was not made, then at that point, you have to either make the decision to walk away if you are that mad. Damn, got like costochondritis or something.
That's because you're not working out.
Anyway, I worked out today. What are you talking about? Or you have an academic discussion so that they understand what your thought process was. Because when you encounter them again, that academic discussion can at least be in their heads.
Yeah.
You know, like they need to understand that, right? Like I've had plenty of academic discussions, particularly about preeclampsia, you know, with nurses, you know, about certain, you know, situations that we've had with patients. And so that understanding, you know, allows them to kind of see things a little bit differently so that now they approach the patient, they approach me differently, they approach what they're doing very differently.
I see that a lot. I'll tell you where I see that a lot. I see that a lot in the ICU, like particularly ICUs where it's a mixed unit where you have medical and medical critical care patients, and then you have surgical critical care patients, and we treat everybody differently.
Right.
Medicine tends to do things like
Hydrate.
No, surgery is hydrate.
Yeah, you guys.
Whereas medicine tends to use Lasix, use Lasix a lot and things, and we're just like, yo, chill, know, or like we're just more not cavalier, but like, for example, like, if someone's creatinine is elevated, but we know that a decision will change based off if someone has, contrast or not. Like, to hell with if they need dialysis. Like, look, I can put a dialysis catheter in, but if I miss some internal bleeding or what have you, whereas medicine tends to be a little bit more like, well, I'm going to lean on the consultant to let me know that, or let's make a decision based off of an ambiguous CT scan. And I get it, right? Because they're worried about the other things that come along with it, right? Dialysis in of itself doesn't occur in a vacuum. Like, there could be some people who just don't come off of dialysis because of that. I get it. So, it's just different. So sometimes, a lot of times the nurses are just like, listen, like, I'm asking a question because, to be honest with you, like, the majority of the patients that I've been taking care of up until this point have been medical patients, and we do it this way. And now you're telling me to do X, Y, and Z. And they may not
understand why.
Yeah.
So that academic discussion, like, don't sleep on that.
Let's get into the last couple of tips, because this show is getting a little bit longer than I thought it was going to be, but
we had a lot to discuss.
We did have a lot to discuss. What are you, my therapist? Let's move on. Hey, tip number 5 is boundaries, yo. Straight up. This is my favorite part, and I keep it short and sweet in this one. Boundaries. Here's one thing that I do. Scrubs never come home with me.
Oh,
I have a lot of coworkers who take scrubs home with them. Scrubs never come home
with me.
Where
they going with it?
They go home with it.
To do what?
I don't know. They just go home with scrubs. They come in with scrubs, and
There's a doctor on Instagram. What's his name? The anesthesiologist. He always posts. He's home, and he has like he's got like his surgical cap sometimes. He's got his scrubs and his white coat, and then he's home, and then he's like making dinner, or he's fixing his bed, or he's vacuuming, all in the white coat and the scrubs.
I got you.
And people are always like, why you got your scrubs on at home doing all these chores?
Well, you got to let people know that he's a doctor.
You could put it in a caption.
Yeah, it doesn't go for the same effect. It's like, remember when we were in med school, and then people would go to like the plaza, and they would go study in they were guys. They're in their first 2 years of medical school.
Not one clinical.
And they would go to Starbucks or what have you,
only
reading a USMLE book in scrubs. I'm like, but why?
USMLE 1.
Why? Like, you didn't go to class in scrubs. Remember that? You didn't go to school in scrubs.
People went to class in scrubs.
But I know people for a fact will go to school in regular clothes.
And change.
And go to Starbucks in scrubs.
But they're studying. Maybe they just want to be comfortable.
Hold on a second. This is before figs. This is before all those other things. These are those stiff-ass those things that my mom used to wear and shit. Like, that I had to iron back in the day and put, like, starch and all that shit. Like, those type of scrubs. You know what I'm saying?
DNA scrubs.
Hell yeah. Why are you rocking these at Starbucks? You just want everybody to know you're a doctor. Just call it what it is. Or you studying to become a doctor. I mean, they can figure it out by the first aid book that you have holding up like this.
Really?
Who reads like this? And highlights. You know, the book is hanging like, everybody ain't got to know that you're reading from the first aid book.
Nee, they put the book on the table. Stop playing.
So scrubs never come home with me, right? For me, I feel like it's like a day cleanse. Right? Like a day, like I've done
I
with the day.
can't say that I didn't do that in residency.
Oh, I did it in residency. It's just because I was just so tired and stuff.
As an attending, I've never brought scrubs home.
Plus my swag was whack back then too and stuff.
Okay.
But
I
now,
don't know what that means.
But now, like the clothes I wear, the sneakers, you know what I'm saying? The Nikes I wear. Yo, them fake Jordans I got.
There's a man with the Transformer t-shirt.
Yeah, I know. This shirt is a little too stiff for me anyway, or it's a little too small. There's a medium. But what y'all think? But yeah, that's for me. The other thing that's really big is I'm not reachable when I go home. Mm-hmm. Right. So the only
text off.
The only person that it can reach me is the on-call surgeon. Right when I'm home, the on-call surgeon, just in case they need me to come in as backup, and the physician assistant who's on call with that surgeon.
Right.
Nobody else can reach me.
Right.
You know, because it's just like, I don't want to answer anything at 7:01, 7:10.
Right.
There's somebody there who can answer that question for you.
Yeah.
And for me, I just feel like it's a slippery slope.
Boundaries.
Because once I answer that question,
you're gonna be liable to answer all the others.
well, it's not even just that, but once I answer that question, then I got to call my colleague and tell him or her what happened, and then they may be like, I don't even agree with that. Why'd you do this? And now you're like stuck in this thing. Like, now I got to go back and call this person and say yes or no. It's just, so I just like, no, the person's on, you handle it.
Yeah.
That is really huge. Cause that, like I said, like those 12 hours that you got me, you got me. After 12:01,
bye-bye.
I'm out, you know? And that's where like the release, like I could turn off the brain. I'm not expecting a phone call because you can't even get through. I've seen some people on Reddit, right? Like they just whitelist. You know, whoever, you know, they want to be able to get through to them. Like somebody was saying in residency, that would be their program director.
Right.
And I think like they're able to change it on a monthly basis so that the co-resident who's on the service with them can get through, but nobody else. And the attending, right? And that's it. So for me, like that's really big. And you mentioned Tiger Text.
Tiger Text off. First of all, let's talk about Tiger Text for a second.
You know, go ahead and cook.
Listen, I'm not about that Tiger Text life. I can't stand it. I cannot stand Tiger Text. And as a matter of fact, when I'm on, the nurses know, if I leave that hospital, I tell them, especially at night, do not Tiger Text me. You can call me, but don't Tiger Text me because I will sleep through that sucker. And if you trying to text me, some people don't know, you're not supposed to use Tiger Text for Uber emergency. Like, that is inappropriate. Like, you cannot use Tiger Text for, you know, she's bleeding something crazy. I need you to come in. That's a phone call. That's a phone call. Number one, it's a phone call because you need to make sure that it was communicated to me ASAP. Number two, it's a phone call because if I need you to do something before I get there, you can do that right away on the phone. Like, Tiger Text is, for me, it's like the lazy man's way of communicating.
You think it's line stepping?
No. Don't make no sense. It's the lazy man's way of communicating. I'm sorry. I think texting in medicine is a slippery slope because a lot of people don't know how to use it. And we are assuming that people's judgment, will lend them to use that text in an appropriate way. Now, if you want to text me and just be like, hey, just, wanted you to know, like, the blood pressure was up and then I rechecked it and was fine. I'm like, all right, cool. I don't have a problem with that. But I have literally had people text me.
Speak about notification fatigue.
Right.
Oh, my God.
Text me.
It's similar to like nurses and alarm fatigue.
It's crazy. Honestly, I'm like, for all of that, I'd rather just have a pager again.
Yeah.
I'd rather just have a pager because that I know I can't.
I think Tiger Text makes it very easy for people to reach you. It takes the barrier away from communicating with you. And I can see the rationale of like, yeah, we always want to make it easier for people to get in contact with you. Right. And we're living in a society now that texts more than calls. Right. And then wouldn't it be better to know what the message is than have to get a page and then find out what it is, right?
Or just call.
I'm just listing what the pros are, right? I'm listing what the pros are, right? So rather than get you get what I'm saying,
right?
But with decreasing the barrier of trying to get in touch with the person who's the decision maker, now what you've done is you've flooded that person with all of these different notifications and decisions, and people just contacting that person with stuff that's really like, I'm gonna use my SAT words, but like superfluous. Right?
Yeah.
Therapy.
Therapy. No, I think, and again, for me, I'm
so that's why I don't like.
There's the assumption of good judgment, and not everybody has good judgment as to when you should text someone and when you shouldn't. I think some of the texts that I have gotten in the past, I can't say that where I work now that they really use Tiger text, at least with me, as much. So I don't get very many Tiger texts right now. But
you a liar.
No, I don't. I really don't. I don't get that many Tiger texts at all. I really don't. Because I'm mostly on the floor, first of all. So
we potting or?
Yeah. I don't. I really don't get that many Tiger texts. And the nurses call me.
All right. So let's move on to number 6. Right?
What?
She over here potting and shit. Are you not potting?
What are you talking about? The nurses call me all the time. They know because I tell them.
Well, now you trained them now, right?
But that's what I'm saying.
But in the beginning, though, that wasn't what you was saying.
No, that's not true, Nee. Not for this facility. Not for this facility. Maybe the one before that, but not for this facility. I tell these nurses from the beginning. I told them from the beginning, if you need me, call me. I'm on a 3-hour, bender. Okay? So if I go to my hotel room, I'm falling asleep. So don't Tiger text me because I'm not going to hear it. You can ask any nurse on L&D at that facility. You can ask them. And they all know, the night nurses. I've told them from the beginning, they don't Tiger text me.
Number 6. Listen, guys, this is something.
What's your problem?
I'm just saying. Number 6. Listen, guys, I bring my own meals when I can. No soda. So no Pepsi, no ginger ale. It's just water. And when nobody's looking, a Red Bull.
When nobody's looking?
A Red Bull.
If anybody's ever looking at you, they're always seeing a Red Bull
That's
in your
not
mouth.
True.
Whatever.
Please don't put that information out there.
I can't
Please don't put that information out there.
I can't.
Nope.
I really can't.
1 Red Bull per shift. How do you know? You're not even there.
You're home. What shift are you on at home? What shift are you on at home?
So your nutrition, the way how you eat, is the same how you eat off shift.
I just want to know.
Is the same way you eat when you're on shift?
I want to know what shift you're on at home that justifies you drinking even 1 Red Bull. Like, for what? What are you doing at home? Did you even need 1?
Listen, man, I'm working out, like, as you can see, my body.
That's its own energy.
My body is on like cock D. You know what I'm saying? Like, I am like, come on, girl. You see this?
What does that have to do with
I
the
burn the
question?
sugar and stuff.
What does that have to do with the question I'm asking you?
You're talking about two separate situations.
Anyway, you drink a lot of Red Bull. Let's move on. What's your point? Yeah. Just the same way you were with the Tiger text. Yep. Tit for tat. Mm-hmm.
Guys, you see, she doesn't do therapy. So that's how she is. So I'm just going to leave that behind me and just kind of move on.
Really?
Because what I've learned about myself is that I'm an empath, and I see that she's struggling with certain things.
Oh,
and as someone who likes to move to a higher level, I just offer you that is maybe consider therapy, baby. You know what I'm saying? So for me, bringing my own meals, me bringing my own like water and all that stuff, so when I go to the cafeteria and when I'm very stressed, I'll tell you right now, if you were to put a can of soda in front of me and water in front of me, when I'm very stressed, I'm going to grab the can of soda, right? Mm-hmm. If you put a slice of pizza in front of me or a salad.
I'm the same.
Or a salad in front of me, I'm going to eat the pizza.
Yeah.
Right?
I'm the same.
So what I've done is I've just made it just very easy for me to be more, to be better with my diet. So I bring in pre-packaged meals and stuff, right? So I use like Factor. I love that stuff, right? They're not sponsoring the show, but they should, right? But I bring Factor in. I have my water. I have my seltzer water because I really like carbonated stuff. So I bring that in, and those are my options, and that's it. Yeah. And that's another game changer of just saying, you know what? No matter how stressed you are, Nee, like you're going to stay at least as you're gonna be okay with your diet,
right?
You're right. Like as long as you're not taking in Pepsi and ginger ale and all these different.
You're not gonna binge on things that
right
you really shouldn't.
That you really shouldn't. You don't have to have 2 slices, because you go to because that's what's available there, and that's great. Now you're right. I got to get that half of Red Bull out of the shift and stuff, but
really, wow. So we just lying on the podcast. Okay.
You was
that's
lying
cool.
on number 5.
No, I wasn't, Nee. What are you talking about?
All right.
Why?
Number 7. So, guys, listen. There is no number 7. But listen, guys, these are the 6 tips. I'm podding. She's not podding. So,
Whatever.
These are the 6 things that I do to reflect and to make sure that I'm keeping myself in the center. Obviously, like, we all do this because we really want to make sure that the patient is taken care
Absolutely.
of. That's the most important thing, right? That's a very important thing. But just as important as that is how you show up, how you take care of yourself. And you got to remember, yo, this is a long haul, yo. This is a marathon. This ain't no sprint.
Yeah.
You know what I'm saying? We talking about this 25, 30-year career. You got to be good to yourself. You know what I'm saying?
Absolutely.
Like
and
this,
you gotta
this takes
know.
time to look like this. This takes time. You know what I'm saying? Alfred, sending me in on here. You know what I'm saying? This Tay Diggs look. This Denzel Washington, Idris Elba look. You know what I'm saying? Takes time.
Anyway,
Therapy.
so also knowing that self-care is going to look different for everybody. And
So you're not even gonna talk about the people who I say I look like.
you do look like you could pass for T Diggs.
People are constantly asking me, what's it like to be a sex
Thank you.
That's about it. So it's not going to look the same for everyone. And, even if you're getting tips from people and you're like, man, it's great that, he exercises every day. Why can't I just exercise
I don't exercise every day.
You exercise 6 days a week, Nee. I mean, come on.
But that took time, though.
I understand that.
Guys,
but,
all this, but that's I think, okay, go ahead.
But that's the point
Here
that
we
I'm
go. Here we go.
making,
She
right?
line-stepping. She line stepping. Go ahead.
Anyway, that's the point that I'm making, right? That you're catching people who might be giving you tips at different points, at different points in their life, in different points of realization. And so you're trying to get to a certain, if a person is trying to get to a certain point, if they're listening to this podcast and they're like, oh man, like, I wish I could, I could exercise every single day. It's like, well, you didn't start out exercising every single day.
Nope, I didn't.
And that was like a journey that you had to take. And you literally were so deliberate about it at first that it wasn't even your habit. It had to become.
You never wore a sports bra before Insanity, did you? That's right.
T25, y'all.
It had to become your habit. And so that's
hairy
what I mean.
chest out and everything, looking like Richard Simmons. Sizzle and sizzle and sizzle and sizzle. Remember those days? And you was laughing at me the whole time.
And sizzle.
Look at this guy. Look at this guy. Look at him. Look at these Billy Blanks and shit.
Anywho.
Yeah.
Anywho.
But it takes time, y'all.
Yeah,
Rome
it
is
takes
not
time.
built. Yeah.
Yeah.
And it takes that. Listen, and you got to practice this stuff, right? Like, being clear with your colleagues, being clear with nurses, or being clear with whoever it may be. That's a lot, right?
Yeah, it could be a game changer.
That's a
for
game
you.
changer. Even being clear of your attendings, that could be a lot. That takes a lot of practice, and that's something that you have to practice for several years before you get to a point where you feel like you're at a steady state with that, right? So, guys, this is me. Me giving you these 7 tips are not like I
There
practice
wasn't a number 7.
Number 6 tips. It's not like I practice these joints like every day, but I try to like get at least I try to prioritize even this, right? And for me, like I like working out. That's number 1. I ain't giving up on that. I like working out, and then everything else, I may or may not have to come around to it depending on how it is. Except for the scrubs, I ain't rocking no scrubs and stuff. But so yeah, I'm glad you clarified.
That would be the equivalent of taking homework with you.
Yes, I'm glad you clarified that because I think that is one thing I don't want people coming out of this is like, yo, I got to do all these like 9 things that he said.
6. There wasn't even a number 7. Where'd you get to 9? 6 things. Woosah. So yeah. No, I think that's important. And I think, what if you could start one thing today, what would that be? Right? So
the first thing you should do is, if you want to start one thing, is text us, yo. 833-230-2860. Text us what you think about this list of 15. Yeah, what you think, yo? Like you think
6.
Do you think that what's the number 1 thing that you would like from this list of 6 that you would prioritize, or do you have your own list?
Do you
Let
have
us
your
know,
own thing?
because maybe there's something I look at your list. I'm like, yo, man, I'm getting rid of my number 2. I'm getting rid of my number 3. I'm getting rid of Renee. I want to get your list. You know what I'm saying?
How I go out the window?
Yo, guys, we need your support, not your laughter on this podcast. All right?
Lord.
You know what I'm saying? But listen, y'all, this was great. We kind of talked about a whole bunch of different things. Text us, let us know what you think. If you think Kendrick won, or if you think Nas or Drake won, what you think about the night shift. What do you think about these 6 tips? And, we'd love to hear what you guys got to say.
Yeah.
We'll catch you guys on the next episode, y'all.
Peace. You stuck?
That was a good episode, guys.